Hi friends, today we will be reviewing Chapter 21 in the text, Fostering Self-Regulated Learning Through ICT, and we'll be focusing on self-regulated learning in eHealth. In this chapter, we will analyze the relationship between self-regulated learning, SRL, and information and communication technology, ICT, in the healthcare system and educational environment. So in Chapter 21, Self-Regulated Learning in eHealth, we're going to be narrowing down the significant concepts of bringing ICT and eHealth into the healthcare field. We will be discussing what eHealth and information and communication technologies, also known as ICT, is, and how it can be used to progress the healthcare system, advantages and objections of eHealth in this field, engaging curriculum design to promote engagement and accessibility to healthcare workers, and self-regulated and metacognition learning to establish success and accessibility to an education in healthcare. So before we dive into the concepts of eHealth and the impact that it can bring to the healthcare field, I want to first discuss the meaning of eHealth and ICT and the reasoning behind it. eHealth is the use of ICT to teach and promote healthcare administration, health education, and research. So ICT is also known as Information and Communication Technologies, is a diverse set of technological tools and resources used to transmit, store, create, share, or exchange information. The research that was shown in this chapter, and which we will soon discuss, is one of the many arguments discussing how ICT in health practices can offer a range of benefits and explore alternative ways of providing health services to students and workers. This integration can better support healthcare workers that deal with overall challenges in the healthcare system, such as an increasingly aged population, changes in disease patterns, and the cost inflation that have put an enormous pressure on health systems. So ICT and eHealth format combat the traditional classroom-based teaching that may not be the best method to provide eHealth education. Due to the hindrance, new educational models and pedagogical techniques have been designed to meet the requirements of eHealth education. eHealth has shown to have a multitude of advantages, such as students having the opportunity to familiarize themselves with online technologies that can be used in the future health practices. The design of the courses are efficient and they're also cost-effective. And while designing eHealth curriculum, there are a number of factors to be considered, such as flexibility of learning processes, allowing students to take control of their learning, and accessibility of healthcare education to students in remote or rural areas. On the contrary, though, there are some objectifications and arguments made about eHealth learning. So this discussion has been very common in the healthcare field. Some of these objections include the argument that eHealth in a clinical would not be the same as person clinicals due to the needs for hands-on practice and engagement, a lack of funding for infrastructure, networks, and equipment that may be needed for online eHealth, and privacy worries and confidentiality issues being a barrier for the wider use of eHealth. There also seems to be a lack of systematic education to provide knowledge and relevant skills in eHealth and in this field. So when looking at the curriculum, eHealth courses have been designed to be delivered on a multitude of learning management systems. These systems may include Blackboard or Canvas. These learning platforms allow the delivery of course material and online assessments, as well as student lecture communication and individualized feedback. These courses also integrate weekly online lectures, discussion forums, real chat time sessions, and online reflective journals are some of the learning activities that are used to promote engagement and interaction in the eHealth environment. Blended and self-regulated learning is also commonly used to incorporate both online learning and in-person for these students. So this approach, the blended learning approach, is going to combat the objection that we saw on the other slide of hands-on clinicals for students, and allows the students the accessibility of working online and that flexibility, but also being able to participate with an in-person experience when required. So in our chapter, Paintrick and Zusho define self-regulated learning as an active process where learners set goals for their learning and monitors, as well as regulates their cognition, motivation, and behavior. This cognition is guided and constrained by their goals and the contextual features of the environment. Designers of eHealth curriculum have incorporated multiple elements, the self-regulated learning within their curriculum, and follow three main pillars of self-regulated learning that are embedded in eHealth teaching and learning. So in the chapter, it presents these three pillars as number 1, promotion of metacognition, which we will soon discuss. Number 2, the promotion of strategic action. And number 3, the promotion of motivation to learn. These pillars are supported by metacognition, which is an awareness of one's thought processes and an understanding of the patterns behind them. This support gives learners an opportunity to play their own learning experience and create their own critical role in their own experience. A few significant points to review when creating a self-regulated and metacognitive learning environment are: 1. How students establish the relevance of eHealth learning in their own practices. 2. How students evaluate their capabilities and expect to use various e-learning tools. 3. How students use blended learning strategies to enhance their learning. 4. How peer learning has taken place. And finally, number 5, how students manage their own learning. So in this chapter, the author does present research done at the Centre of the University of Queensland, which has developed and run a series of multidisciplinary subspecialist services using eHealth telemedicine tools in the areas such as diabetes, endocrinology, cardiology, dermatology, oncology, orthopedics, gastroenterology, neurology, and pediatric surgery. The purpose of this research is to show the effectiveness and the impact that eHealth can have for cost-saving applications and reaching students due to a large number of students who live and practice in rural and remote locations. The flexibility of learning is an important feature, allowing accessibility and more individuals to join the healthcare field. And importantly, a large number of students work in the health and medical sectors, thus allowing the flexibility for their work hours and bridging the learning experience and the applicability into the practice. It is summarized that the main elements of self-regulated learning are attributed to the eHealth teaching and learning as follows, which is number 1, encourage goal setting and self-monitoring to progress towards their own goals. 2, incorporate opportunities for directed and self-directed reflection. 3, develop and foster habit of self-reflection. 4, move away from highly structured assessment tasks. 5, provide learners to make important decisions about their learning process. And 6, provide necessary feedback to motivate learners. So the findings concluded that the majority of students, which is around 88%, agreed that they obtained the necessary hands-on skills during practical, and that over 80% of participants agreed that the practical provided them an opportunity to explore ways of using different technologies in delivering healthcare and technologies that they will soon be using in their field. And that was a wrap up for chapter 21 in regards to self-regulated learning in eHealth. So thank you so much for joining us today, and I hope you enjoyed.